Welcome to the Golden Hour, the podcast community where moms and moms-to-be hear stories from other mothers and top experts in the pregnancy and postpartum care field. You can visit goldenhour.fm for more information, resources, and all other episodes. You can also find us at goldenhour.fm on Instagram for comments and questions. Welcome to today's episode of The Golden Hour. I'm your host, Dr. O, and today I am joined by Kayleigh Summers. Kayleigh is a licensed therapist, writer, and leading voice in the world of perinatal trauma. After surviving a rare and life-threatening amniotic fluid embolism during childbirth, Kayleigh turned her personal experience into a mission to support others. Through her therapy practice, viral social media platforms, and her podcast, she creates a space for storytelling, healing, and connection. Kayleigh's work is changing the way that we talk about birth trauma with honesty, empathy, and deep expertise. I'm honored to welcome her to the show. Welcome, Kayleigh.
Thank you so much for having me. I'm so excited to be here and just get to chat with you. We are already chatting too much and we're like, we have to press record.
Yeah, exactly. I've had the honor of having many guests on the show, but there are only a very small set of guests that I'm so honored and excited to talk about, to the point where I couldn't wait to press the record button because I can go on and on about what it means to have you here. And that has a lot of layers because, as you personally experienced, Kayleigh, I wouldn't be mixing my words if I said you were a miracle, and I'll have you tell your own story, but it's truly a privilege to talk to you. And the fact that you've turned what would be a remarkably painful experience to a passion, a purpose, a mission to lift other birthers and women and survivors up. Just so grateful for not only your time, but the work that you've already done and you continue to do in this space.
Thank you so much. I appreciate it. It's hard to say because it's a weird space to be in to survive something like this. And I'm definitely not someone who thinks my amniotic fluid embolism happened for a reason. That feels very gross and icky. But I do think that I survived in the way that I did for a reason. I continue to feel like I am here to give a voice to the moms, to the pregnant individuals, to the babies who did not survive this complication. And that's actually been in the news a lot recently.
Yeah.
Because we lost a nurse who was big in the educator and content creator space. Actually out in California to amniotic fluid embolism. So it's been a really heavy month and really complicated.
Yeah, really complicated. And even you sharing that it happened to someone that you know personally, someone in this community, is astonishing because it's such a rare event, right?
Yeah.
Do you happen to know the data, like how infrequent, how rare is an amniotic fluid embolism?
Yeah, so amniotic fluid embolism happens in about 1 in every 40,000 births in the United States. So if we look at that on an annual basis, there are between 3.5 to 4 million births in the US each year, and about 100 of those will be AFEs. And right now, the survival rates, which have improved through medical technology, access to resources, the survivability ranges across research from about 20 to 60%. Obviously, that top 60% is going to be people that are at some of the highest level hospitals. So what I like to say is, this is such a catastrophic complication, as I know you know. But even when we have the best resources and the best hospitals with the best providers, we're still looking at a 40% mortality rate at the least. And something that I think a lot of people who obviously are not in this world don't understand is that there is a piece of this that is luck. And that is not to downplay the incredible medical care that it takes in these situations to even give someone a chance at surviving an AFE. But even for people who unfortunately get the best care in the best situations still might not survive this. And that is why it is so just devastating, honestly.
Yeah. I'm going to continue to take big breaths during our entire conversation just to kind of pause and reflect on the families and the birthers have already been impacted, the ones who have been fortunate enough to survive and those who we've lost, and reflect on you, right? That you have created such of advocacy. You've amplified the voices of those who can't speak for themselves, aren't able to. And it's such a strength that you have. And I know that healing is something that I will never minimize how long it takes to emotionally or mentally or physically heal from something as traumatic as going through an AFE, amniotic fluid embolus event. But are you willing to share with us kind of your story, understanding there are
Yeah.
parts of your story that you can't necessarily tell, but maybe people have told for you?
Yeah. I'd be happy to. So I have a very typical story around pregnancy. I had very normal, very healthy pregnancy. My husband and I decided we wanted to get pregnant. We had a really early chemical pregnancy, a miscarriage very early on, which was devastating at the time.
Mm,
And then it took us a while to get pregnant after that. It took us about 6, 7, 8 months. And that is a while in the context of we had gotten pregnant right away. I know many other people who suffer from infertility. That is like a blip on the radar.
mm,
But for us, it had taken us longer than we expected, but we were finally pregnant again. And it was the first grandchild on both sides. So there was
mm.
lots of anticipation, lots of
Yeah.
excitement. And again, I had a very normal, healthy pregnancy. At about 40 weeks and 2 days, I went in for a typical like prenatal appointment. And from this point of the story forward, I have no memory. So the
Mm,
story has been pieced together, meticulously pieced together, which was a part of my kind of trauma healing
yeah.
through conversations with my family, text messages I had sent at the time, medical records, and badgering my medical team for all of the answers. So,
Yeah.
kind of back to that appointment at 40 weeks and 2 days, I had a high blood pressure reading at both the beginning and the end of that appointment, unfortunately, earning me a trip to triage, given
Mm-hmm.
that I was past 40 weeks. And when I got to triage, I made the informed decision with my team to move forward with an induction of labor due to the gestational hypertension and also my concern, and this was very much my concern, that my baby was very large. So my team, like the whole time, I was like, I'm growing a large baby. And
Yeah.
they were like, you're measuring right on track. And I was like,
Yeah.
cool, but
But
I'm growing a large baby. And they're like, okay, like we'll see, you'll be fine.
yeah.
So I had this in the back of my mind. So I was like, you know what? He's only going to get bigger in a week. So yeah, I'm cool with that. And the
Yeah.
gestational hypertension obviously is not something I really wanted to take chances with.
Yeah.
So we moved forward with the induction of labor. I will not bore listeners with a very standard first time mom,
Mom
like
induction.
Cervidil,
Yeah.
fully
Huh.
blue,
Yep. Checking the boxes.
Pitocin, epidural, like, just straight up. Like, so 2.5 days later,
Yeah.
again, and something that I like to make clear to people as well is that this is typical, and I know you know this, but this is typical for a first time mom induction. Slow, steady. We're not trying to rush the body into anything.
Mm-hmm.
And that's what my team had reassured me of.
Yeah.
But so on Wednesday, I had gone into the hospital on Monday, and on Wednesday by midday, my OB had come into the room and she was like, you're finally 10 centimeters. And I was like, awesome. We
Yeah.
did it. She's like, so get
Yeah.
excited. I know you're tired. I know you're a little exhausted, but get excited. We're going to meet your baby really soon.
Yeah.
And so it was my husband, my mom, my nurse in the room. And my husband and I actually decided to ask my mom to come into the delivery of my son, which was not the original plan. So she was very excited and she went out to the waiting room to let my dad know that she was going to be a while. And when she did that, it was my husband and my nurse on either side of my bed. And I turned to my nurse and I said, I'm not feeling well. And she said, okay, that's normal for transition. Let me get you a bag to be sick in. And I
Yeah.
said, nope, something is very wrong. And
Huh.
she turned to look at my vitals. And when she turned to look at my vitals, I started screaming that something was wrong with my heart. And a few seconds later,
Kayleigh.
I know. The
Okay.
impending doom. The
Yeah.
impending doom was real in that moment. Again, I don't remember it, probably thankfully.
Yeah.
But I will share that prior to this event, I am definitely a people pleaser, especially in the medical setting. So for me to scream at a medical professional that like something is wrong and you need to take me seriously, like I can't even imagine how I was feeling
Yeah.
internally. to be like so sure. And that's what they say about impending doom, right? It's different than anxiety. It is not like I'm worried this is going to happen. It is like I know that I am about to die and you need to do
Yeah.
something about it.
Yeah. Oh,
And
Kayleigh.
impending doom is a symptom for amniotic fluid
Yeah.
embolism.
Yes, it is. I mean, I just to take a quick pause. This is one of those really rare events that when we learn about it in our medical training, and they I think we talked about this in the pre-pod, if you will, about one of your colleagues who's in California and who is a huge advocate and speaker for amniotic fluid embolism. I remember when she came and spoke with my residency class at UCSF. Impending doom is one of those things on the list of symptoms, right? And how do you, as a clinician, distinguish that between, okay, someone's having a panic attack, this is a really stressful time, you're about to meet your baby, you're exhausted, versus like a true sense of like, no, 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 no. I know physically something is wrong with my body, and I need to express it in a way that maybe feels antithetical to who I am. I'm going to scream, I'm going to yell because my body is literally yelling from the inside out. Something bad is happening. Wow.
Yeah.
Yeah. Goodness.
So a few seconds later, I did go into cardiopulmonary arrest. So a few seconds after yelling that, my heart stopped. I stopped breathing, and my nurse did quickly call a code blue. And so tons of people came rushing in, pushed my husband, who unfortunately was still in the room, to the back corner, and they began CPR on me. And they did make the decision to take me to the OR because it was right across the hall.
Mm-hmm.
And so they were able to deliver my son within 6 minutes of that code
Mm.
call, which is incredible.
Incredible.
Yeah.
Incredible, Kayleigh. Incredible.
Yes, they were
Yeah.
incredible. And
Yeah.
he did need to be resuscitated,
Yeah.
but my OB will say he is the heaviest baby she has ever delivered.
Well, what was his poundage? Were you right?
So not only because he was, but
Wow.
yes, so I was right. He was 10
Yeah.
pounds, 14 ounces, but also because he was born unresponsive, he had no muscle tone. So he felt, right, like,
Yeah. Very heavy.
yeah.
Yeah. Kayleigh.
Yeah. The NICU
Yeah.
team was thankfully in the OR already at that point. And so they worked on him and he was resuscitated within a few minutes.
Thank
Um,
goodness.
yeah. And so he did incredibly well. And at that point, CPR had continued on me
Mm-hmm.
until the end of that C-section. So he was whisked off to the NICU. The team will tell you, though, in the OR, which always gives me like a nice reframe for my poor son being born into just this like chaos where like his mom wasn't alive, his dad
Mm-hmm.
wasn't there. It was just a bunch of strangers.
Mm-hmm.
But when they heard him cry after the recess, they all cheered. And so I
Yeah.
think about that as him. Yeah.
Yeah. Oh,
Getting
you
that
just
moment.
choked me up already. I've
Yeah.
been in those rooms.
Yeah.
We're all waiting on bated breath. And I always say that the privilege and what makes the job as an OB, and a big shout out to your OBGYN doctor, the nursing team, the anesthesiologist, the NICU team, and everyone in between in that maternal health space. We have two patients, sometimes three if they're twins, but you have two patients and you care that deeply about the outcome of both. So you have a team who's cheering when your son has his first cry, but that team is still waiting on you, right?
Yeah. Yeah. My OB was sewing me up for my C-section as they were doing CPR. So she would actually
Yeah.
have to say, like, pause to sew. Because as you can
Yeah.
imagine, I mean, I think a lot of people don't know who aren't in the medical profession how aggressive CPR is.
Mm-hmm.
And so she was able to finish sewing me up and they were able to achieve ROSC. So they were able to resuscitate me after a few minutes towards the end of that procedure. And then this is when my OB, who is just phenomenal, not only as a doctor, but as a human being.
Yeah.
She's actually come on my podcast to tell her experience of
Yeah.
the story, but she recognized at this point that I was likely having an amniotic fluid embolism, and she knew that we were headed into DIC. I wasn't bleeding
Mm.
yet. She'll always say, she's like, you were bone dry when I
Yeah.
closed you up because you also weren't circulating. So you
Yeah.
were like, I made sure you were bone dry.
Yeah.
She's like, but I knew that it was coming. So we
Yeah.
placed a Bakri in advance and we called for an MTP before you were
Yeah.
even bleeding.
And just for everyone to
Yes.
know, MTP is
Massive
Massive.
transfusion protocol.
Yeah,
Yes.
yeah, yeah,
Yes.
exactly. I know you and I are going to use a lot of medical terminology because you probably came out of this with a medical understanding that you maybe didn't necessarily know that you wanted, but now that you have
Totally.
and you get to educate others. But yeah, just wanted to pause on that. But
Yeah,
go ahead.
thank you. Yeah, and I'll also share that my understanding of DIC, or the way I at least like to communicate it, is essentially your body throws a ton of microclots. It consumes all of your clotting factors and you bleed out. So you have an excessive hemorrhage.
Mm-hmm.
And I did start bleeding shortly after this, and I had a profound case of DIC. So
Mm.
the Bakri alone collected 5 liters in the first hour. And
Kayleigh.
yeah,
For me as an OB, 5 liters is like a huge portion of your own your blood volume. That's the entire amount of blood that you have in your body.
yes,
Yes.
in an hour.
Yeah.
And I required 143 units of blood product by the end.
That's a massive blood transfusion protocol times, I think it's usually 4 or 6 units. That's a massive transfusion protocol times like 10, 15, 20. I'm not good
Yeah.
at my quick mental
No,
math.
me neither. Yeah,
Kayleigh, wow.
I know. I know. So they were essentially putting the blood in as fast as it was coming out.
Mm-hmm.
And unfortunately, about an hour after the initial event, I did go into cardiac arrest again. And so CPR had to be reinitiated. And this was very much the time in the OR where, I mean, a bunch of other OBs had been called in. There was like 10 OBs in that OR, along with
Mm-hmm.
like anesthesiologists, tons of nurses.
Mm-hmm.
And the other OBs in the OR were preparing my OB for the fact that I would not survive this event. And so my OB actually left the OR at that point to go speak to my family. And this was the second time she had spoken to them. Initially, she spoke to my husband right away and basically said, the baby's okay. Kayleigh is not. She's had an amniotic fluid embolism. We're doing everything we can to save her life. And then this was, she had come to my family, who was now gathered in my L&D room together. And she said, we're doing everything that we can, but we can't stop the bleeding and we need you to pray.
Mm.
And then yeah, I know.
Yeah.
She talks about that moment.
Yeah.
And she didn't think that I would survive. And she was hoping that I would and praying that I
Yeah.
would. But she went back to the OR after that, and they had gotten me resuscitated again.
Mm-hmm.
And this is where they kind of realized they were going to need to do something drastic if I would survive.
Mm-hmm.
And arterial blood gases at this point, I actually have an arterial blood gas that was taken from a minute before the second code. And my pH is less than 6.9. And yeah, it was really, really
It was
bad.
really bad. Yeah, and just for the audience, that just essentially means that your body had been without oxygen for a very long time. So you're in a state of acidemia, which happens when we're in a low oxygen state.
Yes.
Yeah.
Yeah,
And your organs do not like that. They need oxygen.
they do not. Yeah. So I'm in
Yeah.
multi-system organ failure at this
Yeah.
point, without a doubt. And so again, my team was like, okay, we got to figure something. We got to get creative.
Yeah.
And so they called out for ECMO to be transported in with an ECMO team. And
So at this point, you're still in the labor and delivery operating room. You haven't
correct.
transferred you to like a higher level operating room. You're still on the
Not
L&D
yet.
floor.
Yes,
Yeah.
exactly.
Okay.
And so they called in ECMO, and they were able to cannulate me on VA ECMO. So VA is for both heart and lung support. About 2 hours after my initial cardiac arrest.
Mm-hmm.
And then obviously I was on ECMO, so it was keeping me alive, but I was continuing to bleed.
Mm.
And they took me down to interventional radiology at that point
Yeah.
and tried to embolize my uterine arteries.
Mm-hmm.
And that worked partially, but just not enough.
Mm-hmm.
And so they took me back to the main OR at this point, because my abdomen had become so distended that I looked more pregnant than I was with my almost
Yeah.
11-pound baby. And so when they opened me up, they opened up my abdomen to another 6 liters of blood and clot. Yes.
Oh,
And
Kayleigh.
so I know. And so they were forced to do a hysterectomy
Mm.
and right salpingo oophorectomy. So they had to take my right ovary because it was just one big, like, massive hematoma.
Yeah.
They were able to save my one ovary. They brought in a gynecological oncologist
Yeah, I
for that
figured.
surgery because it
Yeah.
was, yeah. So that and a trauma surgeon. My trauma surgeon, who we are still good friends to this day. My trauma surgeon, my gyn onc, my OBGYN, and my cardiologist were all women. I know.
I
Incredible.
mean, there's so many layers to the story that you've just told, and
I know.
I don't want to undermine the true trauma of what you've experienced and probably still experience retelling it. So thank you. But um, I'm just proud of the badass boss women who cared for you and kept you here.
I'm obsessed with them. Obviously,
Yeah.
they're why I'm here. But yes, but there's so many, I don't know, I should probably not call them fun, but so many interesting stories of like
Hmm.
my trauma surgeon standing on a stool in the middle of the OR, organizing the chaos in that first few minutes because she came
Yeah.
in to kind of, that's what trauma surgeons do, right? They
Yeah.
run typically a code.
Yeah. Yeah.
And then my cardiologist was part of the ECMO team. So she came
Mm.
in and cannulated me for ECMO. And then, so they did the hysterectomy and they removed my one ovary. And then another trauma surgeon who was actually a veteran who had been deployed to Afghanistan for a while, who
Yeah.
told my family that this is one of the worst things he's ever seen.
Yeah.
Ended up using quick clot combat gauze to pack my entire abdomen and pelvic area, and left me
Wow.
open with a wound vac in place
Yeah.
to try to stem the bleeding that was continuing, obviously, from all of those locations.
Yeah. Yeah.
Yeah.
Kayleigh, I'll take a quick pause. As an
Yeah.
OBGYN who has had the honor of caring for thousands of patients at this point and have had patients who have had to do, it's rare, but do emergency hysterectomies on for different reasons, understanding, the risk associated with doing a hysterectomy when you're pregnant is because the vasculature, so the blood supply to our uterus when we're pregnant, is that much more impressive. It's more dilated. There's more blood flow because the blood flow was meant to sustain a beautiful, nearly 11-pound baby in your case. For
Yeah.
other pregnancies, you need a lot of blood flow to support a pregnancy. And so when we think about doing an emergency hysterectomy, we know that it's a lot more technically challenging of a case, higher risk of bleeding, which is why we often tag in our gynecology oncology specialist colleagues to assist us. But you are thinking, we have to think about doing that emergency hysterectomy in light of everything else you just shared, and that you were in severe DIC. You had already lost 5 liters. They found an additional 6 liters in your abdomen, let alone that you had gone through a second cardiac collapse event. So it's a totally different surgery at
And
this
I was on
point.
ECMO.
And you are on ECMO. Thank you. And you are on ECMO. So it's a totally different surgery. It's a totally different level of risk, let alone, you said it before, luck takes away from the skills of the people who cared for you, the absolute skills of people to take care of you and the strength of your own body. But yeah, this conversation is a pretty special one to have, because for me, as someone who has enough clinical experience to know every hit that your body endured and all the many amazing things that your team did to keep you and your son alive, I just feel honored that we're talking, because that's not a that's not an easy thing to survive.
No, they
Yeah.
and they kept fighting. Like
Yeah.
they put in over 140 units of blood product. Like they had to call the blood bank people amazing. They're like some of the
Yeah.
unsung heroes. There's so many like
Yes.
unsung
So
heroes.
many. Let's give them,
And
let's sing their song right now. Yeah.
the blood bankers, the nurses that ran up and down the steps. I went back to my hospital maybe last year, the year before, 2 years ago. I usually always bring them something on Cal's birthday.
Yeah.
And one of the nurses showed me her time hop, which she had taken a picture of her Apple Watch from when my event started. And her heart rate never came down until 8 hours later, because she was running blood.
Yeah.
And also just the
Yeah.
adrenaline of an event
Yeah.
like this, and like the med students that were holding doors. So something that's important to know is this was not at an academic institution. This was a community-based hospital. So this was a level 2 trauma. So thankfully
I'm applauding all of you
yes,
guys. Yeah.
Yes. I mean, it's an amazing hospital. Don't get me wrong.
Yeah.
It's a part of mainline health system, which is a fantastic system, but it still is a community-based hospital.
Yeah.
So it does not have, the access that a large academic institution does. They had never seen an amniotic fluid embolism before. That hospital came together from all of the OBs coming in to support my OB, and then the OBs from the other practice, because there are two practices that deliver there, covering all the patients on the floor so that every OB from my practice could help support both in the OR and then at the appointments that pregnant women were still coming to, pregnant people were still coming to. So there was just all of this coordination that had to happen in order to save my life. And that's just the tiniest part of it, right? There was
Yeah.
there's just so many stories. There was a critical care nurse who was headed out to his lunch break and works in the ICU and heard the code for maternity and was like, what? And so
Yeah.
decided to turn around. He's the one that did my compressions.
Mm.
There's just so
Mm.
many of these small stories where everything had to work perfectly
Mm.
in order for me and my son to be here today.
Yeah. Yeah. Oh, Kayleigh, thank you for acknowledging so many people on that team, so many of those unsung heroes, giving them space to sing their song. I get chills thinking about each person, the med students even holding the door, the critical care nurse who said, okay, I guess my shift's not over, the blood bank team that says we're going to go above and beyond protocol and give all the blood we have and then some, because we believe in this person's life. We believe that we can at least earnestly try everything we can to keep this person alive. I often say this, and I don't say it lightly, that we're really lucky in obstetrics. Lucky, I'm not trying to throw that word
Air
around,
quotes. No, I got you.
air quotes, in that our patients for the most part are young and healthy, and so we do know that they can endure and survive a lot, right? For me as an obstetrician, I've seen levels of hemorrhage not remotely close to what you went through, but levels of hemorrhage that I know that in a different patient population at a different age with different lists of medical problems would not be able to endure that. But we know that with our young patients, like if we just keep going, they will turn around, their young bodies will pick back up again. But Kayleigh, you were beyond what a normal young body would be able to, quote unquote normal, would be able to endure. And you had an incredible team, who just kept fighting and used their skills to the full depth of their ability. What an amazing group of people. You are amazing. They're amazing. Praise to everyone.
Yeah. And I think my OB really embodies that, because anytime I try to thank her, she was like, there were 100 hands that day
Yeah.
that saved your life. It wasn't
Yeah.
me. I'm like,
Yeah. And it
okay,
was,
you were one of them.
yeah. And then when you hear your story, and I, even though I knew glimpses of your story, but having you tell it to me now and more, we haven't even gotten to the recovery
Yeah.
end of it. But when you hear your story, it's one that does require hundreds of hands, many, many hands that probably, even though you've done so much of your own investigation and deep dive and asking, there are probably other hands that you still don't even know were part of it, but I know that you're still so grateful for.
Absolutely.
Yeah.
There's this weird, I'll dive right back into my story in a second, but there's this also weird universe thing that I think you'll appreciate too, is
Yeah.
also the amount of people, you don't realize this when you go through something like this, but the amount of people who your path kind of crossed with without you even
Mm.
knowing. So
Yeah.
sometimes we talk about third victim. And what we mean by that are patients that were on the unit that day.
Mm.
And one of them reached out to me and was
Wow.
like, hey, I saw your story. I can't believe I saw your story. I gave birth that day. She was like, I
Mm.
was in a postpartum room. She's like, I will never forget it. She's
Uh,
like, I heard the code blue. I tried to ask what was going on to my nurses. They were so freaked out. They're like, we can't really tell you
yeah.
because of HIPAA, but we can tell you that the baby's okay.
Yeah.
And she said, I went back 6 months later for a checkup and I asked about you. And they were like,
Mm.
she's hosting a blood drive at Paoli next week. And she was like, what? And then, yeah. And then I had she was a former nurse at L&D nurse at my hospital. She was having her third kid.
Mhm.
And she called and she was like, all right, I'm in labor, coming in, same
Yeah.
old. And they were
Yeah.
like, you can't actually come in.
Because the team was that consumed.
They were
Yeah.
diverting, and they're like, unless you're
Yeah.
in actual active labor, you can't come in. And she was
Yeah.
like, wait, what? We've never had this before. So she went to her office where they were like, oh, yeah, you're like 6 centimeters dilated, so you can go in. And she was like, I'll never forget walking on the unit that day. She's
Yeah,
like,
the
it was
energy was probably so different.
eerie. Yeah. She's like, I asked about you in between every contraction. And I know it makes me, that like chokes me up. And she's like, so
God,
I'll
what a beautiful
never,
person.
she's like, every July 17th, when it's my baby's birthday, I will always think about you and Callahan too. Yeah.
Kayleigh. I mean, now I'm that day is forever ingrained in my mind, and probably all the many people who've heard your story at this point, let alone the, to use your phrase, the third person victims, or
Yeah.
those who were tendentially affected. Yeah, because there's a general, usually an energy of joy when you walk on the labor delivery unit, some anxiety, some
Yeah.
anticipation, right? All the appropriate mixes of things. But I can only imagine walking on a unit where like 90% of the staff is somewhere else, right? That there's
Yeah.
only like a skeleton crew that's like, okay, we're going to take care of like the active patients, but everyone else is, guns a-blazing, like fully
Yeah.
focused on you and your son's life.
Yeah.
So it sounds like where we left off in terms of your
Yes.
story,
Bring me back.
yeah, no, I mean, it's, gosh, like I said, it's so appropriate for us to take pauses and think about the many people who were involved in your care and the
Yeah.
many people that were affected even up until this point. But it
Yeah.
sounds like the trauma surgeon had left kind of a packing in to help kind of hopefully coagulate, so minimize the bleeding. You were left open with a wound vac, so that's kind of a special device to kind of suction any extra fluid or blood and give them a sense of any fluid accumulation. And then assuming that that's when they brought you to the ICU.
So actually, because the hospital I was at didn't have ECMO capabilities, I had to be transferred back to, not back, but I had to be transferred back to where the ECMO unit had come from with the ECMO team. So about 8 or 9 hours after the initial event, I was prepared for transport, and they told my family that they were able to see me in the hallway as they were going to wheel me out before I was taken to Lincoln All Medical Center. My husband was the first one to kind of like come up to me. There was like 12 providers around my bed, and he just said, like, you did such a good job. Callahan is perfect. We just need you to keep fighting to get the chance to meet him.
What a beautiful
Yeah.
man. Yeah.
Yeah. So yeah, they were able to get me transported. And then the biggest issue, so early Thursday morning, my cardiologist talked to my family and they were like, listen, we have tried every medication under the sun. Dobutamine, epi, ECMO was keeping her obviously oxygenated and
They couldn't keep
perfused.
your blood pressures up.
My heart wasn't recovering. And they really had expected it to. Most AFE survivors, once you get them on ECMO, if they're going to survive, will kind of slowly recover over time on ECMO. But my ejection fraction was crap.
Oh.
And so again, they had tried all these medications. They were making me tachycardic, but they weren't changing my like pulsatility. And so they told my family they were going to try one last thing. And that was the Impella, which is a tiny heart pump. It's actually the world's smallest heart pump. It goes up into your left ventricle through your femoral artery. And it offloads that left ventricle to hopefully give your heart the time it needs to rest and then again, hopefully recover. If it didn't work, I wouldn't have survived because obviously I wasn't really a transplant candidate and my heart would have just had a massive clot and I again wouldn't have survived because it just wasn't moving blood.
Yeah.
So they were able to insert the Impella that Thursday morning. And then my son was actually compassionately transferred later
to
that
hospital.
night.
Yeah.
So he did so well so if you look at his cord blood gases, horrific.
I'm sure.
But unbeknownst to me, babies tend to bounce back very quickly, especially if they're, he was delivered very quickly.
Yeah.
So he was only in the NICU for 1 day. And he was just on like some oxygen, but
good job, Cal.
He was mostly fine. I will say for people listening, most babies, if they are still in utero during an AFE, almost all of them get cooled for 72 hours because there's that loss of oxygen. Again, my team got him out in 6 minutes. And so I think that along with like the fact he's like the size of a toddler had something to do with. So when I say he was compassionately transferred, essentially he was transferred to be with me or at least close to me. He didn't need NICU support. So he was actually just like boarded in their nursery.
Yeah.
And one of the most impactful things that they did, and my CTICU nurses talk about shouting people out,
Shout them out.
incredible humans. So
Yeah.
I was on ECMO in the cardiothoracic ICU, which means I had like two nurses that like I
Yeah.
was their only patient, because one was
Yeah.
ECMO and one was like the general CTICU nurses. And they fought so hard for Cal to be skin to skin while I was on ECMO. Yeah.
Mm.
So 24 hours after my event, he was skin to skin in the
Mm.
CTICU on ECMO. Again, because he was stable, which we were lucky
Yeah.
enough for.
Yes.
But I get a lot when I advocate for this for other patients that I'm
Yeah.
in contact with, I get a lot of pushback. And the benefits of this are insane when the baby is stable.
Yeah.
I know it feels very risky to providers to bring a baby into an ICU, but my CTICU nurses were like, no, this is so important. Even to my
Yeah.
husband, he was like, you're not going to put an 11-pound baby on her chest. You just said she's literally like dying. You can't.
Yeah.
And they're like,
Yeah.
no, you don't understand. This isn't just for the baby, it's also for Kayleigh.
Yeah. And can you share what the benefits are from what you know it to be in terms of skin to skin?
Yeah, so we do see, and I don't know the exact, there's actually research on this, and I
Yeah.
don't know the research off the top of my head, but I
That's
can tell
okay.
you from my experience. One, I will just tell you the projection of what was told to my family, shared with my family, was that I would take like one step forward, two steps back, as we see in a lot of these critical care situations. And then I'd
Mm-hmm.
be on ECMO for probably about 2 weeks. And then I would be in the ICU, like stepped down from the CT ICU for a few weeks. And then hopefully I'd go to mother baby for a few weeks. And then I would go to rehab. And so the Impella worked really well. And I had skin to skin every day. And 2.5 days after my event, I was doing so well that they took me back to the OR to downgrade me from VA to VV ECMO. So from heart and lung support to just lung support. But when they clamped off my lines, I did so well that they completely removed all support. They decannulated me completely from ECMO and removed Impella at that point.
Wow.
So that was not what was projected. And every
Yeah.
time they laid my son on me, my vitals improved.
Mm. Kayleigh. Yeah. I believe I am a person of science, but I'm also a spiritual person, and that I do think that there's something very important about the mom baby connection, and
Yes.
recognizing that there are plenty of dyads, so mom and baby pairing, that are separated for reasons out of mom or baby's control. But when we can support that connection, I think that we're letting your natural physiology and the baby's natural physiology synergize and work
Yes.
together and attenuate something that's really important. Like the golden hour, the podcast name actually comes from the concept of the golden hour, that first hour of life where, there's a whole change of your oxytocin levels and hormonal changes that help moms kind of start that physiologic postpartum change, breast milk production, etc. But it's not just the hour, right? It's any time mom and baby connecting on the chest. And so shout out to those two nurses who advocated and probably went against protocol and said, we think this is important, because I can imagine what your body was doing each time, whether it's truly physiologic and that they really truly saw that your lungs and your heart and your vasculature were just like, we can take out these devices, we can take out all these lines of heavy duty life support, if you will, because physiologically your body was like, no, we're at that stage already. But I believe in a true deep connection between mom and baby, and that's something that when you practice in OB long enough, there's something beyond what we're doing. There's some beautiful magic between the two of you.
Yeah. Again,
Yeah.
I understand wholeheartedly. ECMO and Impella saved my life.
Yes.
And
110%.
I think there was something about me recognizing that, oh, yeah, like not consciously, but in some
Mm-hmm.
deep subconscious, right? I had a baby and now the baby is here and I need to fight.
Mm.
This is my purpose. I need to be able to survive this. And I think that adds to it. I do not think it is like the sole reason, but I do think it does show us an improvement of outcomes and kind of like coming back to our body in a way that
Mm-hmm.
is different. And so I will
Yeah.
always push for it when it is possible.
Yeah.
But yeah, so then I had 4 more like slaps and washouts like each morning that I was in the CTICU. They would bring me back to do another X lap and washout. And that Saturday, The event happened on a Wednesday. By Saturday night, I was extubated. And I also had my fourth and final X-lap and washout and was closed.
Yeah.
And then on Sunday, I met my son for the first time
Mm.
while conscious. I don't have any memory of it, but
Yeah.
we have really beautiful videos and pictures.
Yeah.
And then the next day, Monday, is when I have my first memory. And this is where I really want people to understand the difference that my team made in my care. Because
Mm.
yes, they saved my gosh darn life. Like they are
Yes.
the
Yes,
reason
they
that I
did.
am here and then I get to be a mom, and I've gotten to watch Cal grow up for the last 5 years. And they were incredibly traumatized by this event. And they didn't let that. Now you're allowed to be traumatized. I talk about provider trauma all the time. We got to deal with it. We got to give support. Systems need to change. And they didn't let their best possible outcome, which is what happened, which
Mm-hmm.
was my cardiologist texting my OB being like, dude, she's sitting up in bed texting people. And my OB was like, what? She's like, yeah, she's like fully cognitively intact. She's totally fine. And so like what I try to explain to people is for providers in these situations and severe maternal events that they save, and in this case, cognitively intact, I have no long-term complications. That is like they watched me die and they were certain I wasn't going to survive. And then they got the best possible outcome they could.
Mm.
For me, I walked into the hospital to have a baby and go home. I didn't expect to almost die in the process, lose my uterus, not be able to have any more babies. And what my providers truly understood, which you'll see in what I'm about to share, is that they understood that my perspective was not theirs. And not that I wasn't crying tears of gratitude to be alive, because I was, but they decided, my OB and my anesthesiologist decided to offer to my family that they would tell me what happened to me, because I kept waking up and being
Yeah.
like, what's happening? And my family was
Yeah.
like, you had a C-section with some complications. And I was
Mm.
like, seems like
Yeah.
more than that, but
More
okay.
than, yeah. Yeah.
And they're not medical providers. And remember, I wasn't at the hospital where it happened. So my OB and my anesthesiologist for my initial code came, and I'll never forget this moment. They sat on either side of my bed, and each of them held one of my hands. And my OB talked me through exactly what had happened to me. And I'll never forget the way that she told me about my hysterectomy.
Yeah.
Because she very much could have. And I think there are some OBs out there that are like, I mean, collateral damage, you're lucky to be alive. Like, that's kind of like nothing. And that's not the way to approach it. But I
Yeah.
can see where that would come from. And my OB was like, Kayleigh, we tried so many things. I promise you, we
Yeah.
tried so hard to
Yeah.
save your uterus. But we had to do a hysterectomy to save your life.
Yeah. Yeah.
I will just never forget the empathy and compassion with which she told me about that.
No, I mean, I reflect on those rare hysterectomies that I've done, and it's always been a situation where it's truly life-saving, and it's a skill I have. It's a skill that I am proud to have, but it's a skill that I don't really want to use that often, right? That
Exactly.
similarly in your case, from Bakary to giving you multiple units, including, platelets and FFP and all the other things that are supposed to help you hopefully stop bleeding, taking you to interventional radiology for uterine artery embolization. Fortunate that you have such a great community hospital that has that, right? But they did so many things before ultimately having to do the hysterectomy. And for most of us OBs, we don't underplay what it means to have to go to the hospital expecting to give birth to a beautiful baby and leave the hospital missing a vital organ, an organ that's part of identity, is part of your ability to continue to make a family. And so I really want to pay homage to your OB, to your anesthesiologist, both holding your hand to retell that story in a way that's empathetic, in a way that's acknowledging, yes, there's trauma in what you experience, and trauma in hearing the story again, but they probably told you that story in a way that they felt were best to honor what you and your body and your family members experienced.
Yeah,
Yeah.
I absolutely agree.
Yeah.
And so, yeah, I was transferred down to the like cardiac ICU, and um, I was hell bent on not going to rehab. Exactly 14 days after my amniotic fluid embolism and the birth of my son, I was discharged straight from that ICU to home.
Wow.
Yeah.
Kayleigh, You're strong, woman, girl. So I'd like to take a moment to tell you this is my passion project based on years of experience as an OB/GYN doctor. I aim to empower moms and moms-to-be and those in the pregnancy and postpartum care space. If you appreciate what I do, please take a moment to like, subscribe, and share with your friends so we can reach more people like you. You can visit goldenhour.fm for more information, resources, and all other episodes. If you have any requests, suggestions, or questions for future episodes, please email me at hello@goldenhour.fm or leave us a comment at goldenhour.fm on Instagram. Can you tell me a little bit more why you were so hell-bent not going to rehab? Was it just that feeling of like, I've got this, I can do this, I don't want to be away from my family longer, all of the above?
Yeah, all of the above. Listen, rehab's amazing, and I was not in the right state of mind. Like, looking back, like, I don't know why I was so against rehab. You know how like things happen.
Yeah.
But because rehab's incredible and amazing. And they were like setting it up where like that we have a great rehab facility where they have like rooming in, like we could have like had the baby. Like there was lots of great pluses. Two things. Once I was aware in the ICU, I always say the ICU is like a great place for saving lives. It is not great to be aware in.
Yeah.
I was so uncomfortable. I wasn't sleeping. I felt like every time I tried to sleep, I was afraid I would die. And then one night I had, just to add a little flavor, I had a run of SVT.
Of course.
I'm also someone who like gets palpitations.
Yeah.
So it wasn't out of the, like I didn't freak out, but the team watching the monitor in the middle of the night came in and slapped AED pads on me. As someone who had been in cardiac arrest, it was horrific and traumatic. So like all of these things, I wasn't sleeping. It was terrible. I just wanted out. I wanted home. I wanted out. And I'm also a very competitive person. So that was another thing.
You're just like me.
Yes. So I played Division I soccer, and I was like, and which I think definitely helped with just like my recovery and being in shape and things like that. But I was like, there's a video of me walking like the little fake stairs in the ICU, like with this big smile on my face.
Yeah.
And my nurse in the background's going, "You're not going to qualify for rehab." And I was like, yes, that's the goal. Get me home. So I think I wasn't able to stand like earlier in that week. And then by the end of the week, I was walking stairs. And I just have a body that has a high pain tolerance. And I like to explain to people that's not a choice. It's not like I'm just like tougher and like literally how your body interprets pain, like the pain that you actually feel. I know you know this, but I feel like when people say I have a high pain tolerance, it sounds like I'm like, oh, I'm just so tough. But really, it's
you're not
really
bragging.
just no. And so that I think helped a lot in being able to just kind of start walking. And by the time I got home, like I was walking up and down my stairs. I didn't need to have a bed downstairs, but I was sleeping like 14 to 16 hours a day.
Yeah, your body was exhausted.
And so when I got home, I really felt like I got the goal. Like all I wanted to do was get home. I'm home with my baby. And I was like, we're going to kind of sail off into the sunset of this family of 3. This is my second chance at life. And so it was really devastating when that is not at all what happened.
Yeah.
I couldn't take care of my own baby for months.
Yeah, I can imagine. Yeah. You know, there were so many parts of your your AFE story, and then the incredible resuscitation then after that we had to speak to, because it's an incredible ordeal that you survived, but your story continues, right? So I think as an OB, I think about not only your physical but your emotional recovery, your mental recovery. I think about things that you highlighted. I think about the emotional recovery of your OB, right? Very selfishly, I'm thinking about the mental state of, okay, I was a part of the many that helped this person survive, but what is my experience as in terms of recovering from my provider trauma? And then I think about your family. I think about your mom, who thought she was going to come back into a delivery room to get to meet her grandchild, but instead was told within hours that maybe you weren't going to survive. I think about your husband, who saw you for that very first time when things were still very much hanging on the balance right before you were transferred to the tertiary care center. Just so many people that were then affected and had to process all of this. So let's start with you. Yeah. How And one of the reasons why I have you on is not necessarily because of the AFE that you experienced and that you survived, and that we acknowledge that it's an incredibly rare event. So most of the women who are listening are fortunately never going to experience this, but it's about trauma, right? Because I think for me as an OB, it's one of the most enlightening experiences I have had as an OB. And you think about, when you're a trainee, you learn everything. You know the differential for, like, if a patient presents with the AFE, you have that differential. You're so smart, but it's not
In
until
your
you
head,
actually
yep.
practice that you get to care for people that you actually really learn. And I think about the plenty of second, third time moms who come into that first OB visit with me with some trauma from their first delivery. And again, acknowledging how rare AFEs are. And I've not had a mom yet who survived an AFE and are coming to see me for their second pregnancy. But even things that I think sometimes as OBs, we're like, oh, that was a normal thing, but it was trauma for them, right? I still remember a patient
Yes.
who had preeclampsia in her pregnancy, and her husband came into the visit saying, yeah, she almost didn't make it in our delivery. And I was like, oh my gosh, what happened? And he explained that she had preeclampsia and what they did. And I listened to him and I was like, wow, his experience, even though for me as an OB, I know exactly how they manage her preeclampsia. They gave her blood pressure medication. She got magnesium, all things that are within our breadth to care for. And we can prevent the really scary sequelae of preeclampsia because we have a really good system now, right? His experience and her experience was one of trauma, right?
Yeah.
Or the patient who, pushed for 4 hours and suddenly needed an emergency C-section because the baby had a prolonged deceleration. Her experience was trauma, and so she wants a repeat C-section because she doesn't want to have to ever go through that again. And so I recognize that there are so many who are going to experience trauma in very different ways. And OB is something where people often think it's going to be happy. OB is happy. There's a baby that comes out the end, everyone's happy. And I really do want to not take away from the happy moments. There is so much joy. It is so, so beautiful. But there are so many people who do experience a version of their own trauma. And I think we're amiss if we don't recognize that and we don't help women process that, and other birthers, how do they get through that experience? So thinking about kind of your postpartum experience, knowing that it's a very different one because of all the things that you went through, what are some of the pieces of advice that you give either clients that you work with now or listeners that are tuning in right now about how to kind of experience your trauma, process your trauma, work through your trauma, right? These are all phrases I'm putting in quotes because I know there's so much more than that.
Yeah. Well, first of all, you make a really good point because 1 in 3 individuals report feeling traumatized by their birth experience. That, to put that in context, that is over 1 million people a year coming out of their birth feeling traumatized.
Yeah. Yeah.
And
It's
so
huge.
it's huge. It's absolutely huge. And I think the biggest advice I would give to kind of like start out is that you are allowed to be grateful that you and or your baby have survived, and also grieve the experience that you didn't get to have, or be angry about the experience that you didn't get to have. Those two things are not mutually exclusive. You can feel both at the same time. And that was really hard for me. I had a lot of survivor's guilt. I felt very strongly in those early days that I could only be grateful, because how dare I, as someone who survived something that she shouldn't have, feel anything other than gratitude. But the only way for me to heal, to move forward, was to allow myself to feel angry and sad about everything that had happened to me.
Yeah.
Society does a number on us about just be grateful, at least you and the baby survived, et cetera, et cetera. And so I just want people who are listening to know that you can absolutely be grateful and also be sad and angry. Again, those two things do not somehow negate one another. We are complex human beings. We often have more than one emotion that, these emotions are conflicting at the same time. And so that's always where I start, is the ability to allow yourself to feel the emotions without guilt or without shame. And for people listening to a story like this one, I love that you brought up this piece, because this was the point of starting my community is, I had this horrific event. No one else was talking, it felt like, about when things go wrong. And I started kind of just sharing about my story. And then I recognized there's this whole massive group of people who have experienced whatever their trauma is, in whatever way they've experienced it, but we're all ending up on the other side with very similar feelings and impacts. And so if you're listening to this being like, oh, well, that's nowhere near like that. Mine's nowhere near as bad as it doesn't actually matter because while that event will always be so important to the person who experienced it because it is our personal story, it's actually when it comes to trauma, it's less about the event and more about the way that our nervous system processed that event. So, perinatal trauma is essentially anything that overwhelms our nervous system's ability to cope throughout pregnancy, birth, and postpartum, and leaves us with ongoing distress.
And
And so, yeah,
of
go
course,
ahead.
that with that definition, it's going to incorporate so many people, right?
Yes, and I will say that I would make the argument that much more common is relational trauma,
Mm,
obstetric violence,
mm,
and mistreatment
mm.
then is obviously severe maternal events, right? Those
Yeah,
are about 50,000 a year. Still, obviously, a massive amount in a group that I speak to a lot being in it.
yeah,
If you are listening and your birth looked quote unquote fine on paper and you still feel traumatized by it, that is valid. And you are not
yeah,
making it up and you are
yeah,
not wrong. You deserve to be like respected and
yes.
valued and validated in your birth experience. And part of my goal is helping because I don't think that providers are inherently like evil humans, obviously. Like you know that.
No,
And so part
no.
of my goal is bridging the gap. And that has
Yeah.
always been my goal is helping providers and healthcare workers understand that some things that they think might be reassuring, like someone being upset that they now have to go for a C-section and a nurse saying, it's no big deal, people have to get C-sections all the time, is actually dismissive.
Yeah. I was
And
going to say that's an incredibly dismissive statement.
yes,
Yeah.
and I think that
Yeah.
nurse believes like, oh no, I'm like helping them feel better about it,
Yeah.
right? Like they're not meaning to be like, oh, I'm going to dismiss you because you're annoying me. Like very often that is not the case. And so helping them understand like, hey, that feels really dismissive. If you were to actually just validate and say, I know this isn't what you wanted, and I hate that you're not getting the experience that you wanted, and we're going to do everything that we can in that OR to still give you pieces of the
Mm,
experience that you're hoping for, that literally changes people's outcomes. That
I believe
changes
it.
the way they feel about their birth experience, even though it didn't go how they wanted it to.
I believe it. No, there have been so many times where, as I said, that I reflect on kind of the trauma of the experience, whether it is the unexpected C-section, the very rare emergency hysterectomy, or things that are, again, to me, relatively common, like preeclampsia, and wondering the role of the obstetrics provider, whether it's a doctor or the midwife or the nursing team, the anesthesiologist in that trauma. And so naming relation and realizing that those of us who are in the maternal health space, we we have so much privilege, but we also have power that we sometimes don't recognize, and that we can unknowingly wield that power and contribute to someone's traumatic experience just by simply our words, by our body
Yeah.
language. I think there's a lot of us, and there's a wonderful wave of education around trauma-informed care and how to speak with patients and to support people, how we position ourselves in a room, right? Sitting down and talking to someone eye to eye level, even if I'm coming in for an emergency C-section and my energy and my adrenaline levels are up because I know I have to get this patient to the OR ASAP, I can sit for a moment and say, we have to do this emergently because of XYZ. We're going to take good care, and I'll tell you more after. And things like debriefing after. If I'm
Yes.
ever, for any clinicians who are there, not to say I'm an expert, but I've learned on the fly, and I'm continuing learning. That's why you're here right now, because you've taught me so much. But even the role of debriefing. So what your anesthesiologist and your OB did when they went and found you in the ICU and talked you through everything, debriefing can go a long way. And offering debriefing after the debriefing, being like, hey, you might just get 10% of what I just said right now because you're still
Yes.
processing this. But if you and your partner need to debrief with me later, please send me a message. We're going to schedule another chance to check in, and we could keep checking in until you've gotten the clarity that you need. And even knowing that I had a patient who saw me, goodness, was it 5 years after her delivery for a pap smear, and she started crying, and she
Yeah.
realized it wasn't until I haven't had a pelvic exam since my delivery. I've held it off for a reason, and it wasn't until you started doing my pap smear that I remember trauma around my delivery. And I went back to her
Yeah.
chart and read everything, and it again looked like a normal delivery, but she held on to something, right? And so for me as the OB in that moment, even though I wasn't part of her delivery, I have to pause at that pap smear, at that annual exam, and talk to her and create space and listen, right? That we in this maternal health space and women's health, I think a burden that is an onerous one, but one of honor, because we have the ability and the privilege to create space and listen and recognize that there's so many touch points along the way that can unfortunately lead to scars and wounds and trauma. And we can minimize that by listening, by answering questions, by being curious and open. Is there any other advice that you give? For me, a always lifelong learner, OBGYN or any obstetrics providers, midwives who are listening?
I think I'll share just anecdotally I just posted about this last night, and the comment section has me in tears. Because so often, and I share this in every presentation, when I'm talking about like, hey, these are some things we should try to not say. These are some dismissive things. This is how we can create trauma. We can cause trauma. I always remind healthcare workers, though, that also in almost every conversation I have with clients, they will share the most horrific experience that they have experienced. And then they will say, but there was that one nurse. There was that one doctor. There was that one anesthesiologist, that one midwife. And the comment section on this post is a true testament to that. People are like, my nurse, Sandy, I will never forget her. It was 17 years ago. Like the protective factor that you can play, even in an incredibly traumatic situation. Like, I don't want people to lose hope or to get caught up in the like, what if I don't do it right? If you are validating and calm and present with your patients, you are going to be a protective factor in their story. And that, I'm telling you, like that actually helps when I do work with clients to heal from this perinatal trauma. Having protective factors and adaptive information as a part of their story helps with healing. So like when we talk about power, like you have the power to get to be that in someone else's story.
Yeah.
And that's remarkable.
Yeah. It's incredible, and such an important reminder that we can wield that power in such an empathetic, generous way. I love the work that you're doing. I love that you're creating space for people to reflect on an experience from 17 years, right? That there is something so life-changing and transformative about bringing life into the world, also acknowledging the people who don't have the honor of doing so, but still choose to start families in different ways.
Yeah.
And so of course that can have a lasting memory. We've talked about so many people in this experience, and thinking about postpartum, thinking about your family who went through this in the hospital and afterwards. What was, not to speak for your husband, your mom, your family, your friends, there's so many people. I know it's such a big group of people who went through this with you, but what advice do you give the support people who are supporting someone who's experienced perinatal trauma? Again, acknowledging that it's not necessarily as extreme as an AFE event, but any trauma that they've gone through. And what have you learned from the people that you loved, or you do love, excuse me?
Therapy. After my event, I feel like I was like Oprah, like, you're getting therapy, everyone's getting therapy. Yeah, I talk about trauma soup a lot. Like we were swimming in trauma soup. Everyone was traumatized in their own ways. And something that I feel like my support system did a very good job at is there's something called the ring theory, where when an event occurs, whether it's traumatic, whether it's grief, you've lost someone, the person who it like happens to is at the center. And then my husband and probably my parents would be the first ring, and then like further out, friends and family, and so on and so forth. And the idea is that you support in and you get support out. So people shouldn't be coming to me requesting support for the trauma that I went through, which happens.
God.
Like in-laws, this did not happen to me, thankfully. But in-laws being like, that was so hard for me. That was just like so hard to see that. And like, you're allowed to have a hard time. That's not what I'm saying. Again, my whole family was traumatized, but giving space to the person to be able to talk about their story if they want to. And also, I know it is so hard to watch someone you love suffer, but telling them to stop suffering because it's uncomfortable for you is not fair. saying like, well,
Yeah.
you just need to move on, you just need to get over it, often comes from a place of like, it is so difficult to watch you suffer. It is so
Yeah.
painful for me because I love you so much that I'm going to tell you something that's super dismissive because I want to stop having to sit in the grief with you.
Yeah.
And people don't often realize that it's like a subconscious thing.
Yeah, they don't not intentionally doing that, but it's
Yes,
yeah.
but people like, again, they can be grateful and also just so much grief about what they experienced and what they went through. And also, I want to remind people too, like, I'm all for gratitude, don't get me wrong, but accessing gratitude with a traumatized nervous system is incredibly difficult.
Imagine.
So,
Yeah.
yes, like grateful because you're like here. But also, after experiencing so much physical and emotional trauma, it is sometimes really hard to access that gratitude. And telling people to just be grateful when they can't even access it is like doubling down on the fact that they already feel so terrible that they
Yeah.
can't access that gratitude. And so, for those who have experienced this and are listening, I want you to know that as you are able to sit with the grief and the anger and start to accept it, heal with it, move with it, that's when you're able to access more joy and gratitude. You have to be able to sit with the hard stuff first. You can't like force your way to gratitude by writing down 3 things that you're grateful for every day, like therapists might say. We love that
Yeah.
exercise, but not when you're
Yeah.
traumatized.
No,
Not
it's
when
too
you're traumatized.
what do the kids say these days? Hashtag too soon.
Too
It's
soon.
too soon. It's too
Let
soon.
people be sad and angry. Yeah.
Kayleigh, something that you said that I didn't miss was you said that, even when you got home, it was months until you were able to care for your son, right?
Mm-hmm.
And there's probably a period of mourning. I'm going to project some emotions that I can
Go
imagine I
for it.
felt at that point,
Yes.
but mourning, frustration, anger, whatever it is. I don't know what that soup of emotions it was for you. How did you, sweet Kayleigh, how did you turn that soup of emotions, positive and negative, into what you do now? What was that moment when you were like, okay, I'm ready to give back. I need to give back. I want to give back. What helped you become the birth trauma mama?
Yeah, that's a hard question.
Yeah.
It took a while. And it wasn't
Yeah.
all at once.
Okay.
I did decide one day, like, hey, I'm going to talk about this. But it was more like, hey, I'm going to talk about the story because everyone only talks about happy, beautiful, wonderful, which we love for the people that get to have them, birth experiences. But I decided to talk about it. And then as I kind of said, like, I realized there was this whole world of people who were suffering.
Mm.
And something that really sparked it for me is I was like, most AFE survivors feel this way. Like, I survived this. What am I going to do to like help with, like, I don't want this to ever be another family story. I shouldn't say
Mm-hmm.
every survivor, but a lot of us have that similar feeling.
Yeah.
And I'm not a doctor. I don't work in research. So I was like, what is my skill set? I'm a therapist. I was a therapist before I had my son. And I was like,
Yeah.
I do feelings, I do
Yeah.
emotions. So I'm going to talk about birth trauma. I'm going to talk about what it means to experience it, how we can begin to sit with it, move toward healing. We're always progressing toward healing. It's never really ending, in my opinion.
Mm-hmm. Mm-hmm.
And that's when I started to talk about my story. But then I would say a year after I first started my Instagram, I started integrating my clinical expertise with my personal experience. And that's
Mm.
really where more of like the birth trauma mama, I think, support and community began to exist.
Yeah. Yeah. Because I think it's beautiful, remarkable that
Thanks.
you're paying it forward. I think that there's so many um birthers, their family members who've already benefited from you, and will continue to benefit from you creating this space. I make this joke with my patients often that my arch nemesis are Dr. Google and Nurse TikTok, and that there's a lot of information out there,
There
and
is.
sometimes it isn't vetted. And I think I believe in freedom of expression. I myself am on social media for a reason, right? That I
Totally.
think we should be able to express our feelings and our thoughts, but there's something to be said when there's a voice out there who not only has a lived experience like yours, but is also vetted by your expertise as a therapist, and providing a space of education and empowerment. But I'm curious, as someone who is a leader, is a thought leader in this space, is a content creator, what are your thoughts about social media? And what I mean by that is that there's this there's this interesting milieu, there's this interesting environment where there is positive, there is negative, and I think what you and are consistently doing is paying homage to the other sides of the birth experience. But what I also experienced as an OB is that patients come in, especially those first time moms who've never had a birth experience, come in with a fear of what their experience might be because of what they see. What advice would you give for an either expecting mom or someone who hasn't even gotten pregnant yet and is planning to, but maybe is anxious about even pregnancy because of, there are so many possibilities. And we just spent, well over an hour talking about your very rare, scary event that you lived through, about how to process the many pieces of information that social media gives us, and how that can affect, cloud, influence our thoughts about our own pregnancies or impending pregnancies.
Yeah, this is such a good question. So first, I will say the way that I set up my space, or like my belief about my space in talking about birth trauma and talking about scary stories and talking about the side of birth that we don't talk about, is so that people have a space to feel not alone, right? First.
Yes.
And then
Yes.
also for pregnant individuals, not to be sitting there like soaking up this content on a daily basis. More so to say like, hey, I know this community exists, if that is my fate, so be it, that I experience birth trauma. I know I'm not alone. I know I have a place I can go to. I know I'm not crazy, because that's the most common feeling, is that you're like, so I hate motherhood if this is what motherhood is. It's not. It's your traumatized brain.
Yeah.
I don't know why I did this. Like all of these feelings, like I'm a terrible mom, and it's trauma based. And I want people to know that they're not crazy if that happens. So if you are a pregnant person and you come across a space like mine, you are free to block. You are free to be like, okay, birth trauma is a thing. Got it. Need to be aware of that.
Yeah.
And I don't need to sit in like all of these traumatic stories. I don't need to see another video of Kayleigh on a ventilator. Like, I'm good. That's cool. I'm down for that. I get that. We need to protect our peace. And I will also say the AFE piece is one I get a lot on, especially on TikTok, where the algorithm's random. People be like, I didn't need to see this when I'm 16 weeks pregnant. I didn't need to see this. I'll be like very transparent. My initial response inside my brain is, imagine experiencing it.
Yeah, like, come on, girl, I lived it.
But I also, as someone who is an anxious pregnant person, really do commiserate with that feeling. And so when people ask about this, something I do say is talk to your OB about it. Like, I really want OBs to listen to this too, because when a patient comes in and says, I'm really terrified of an amniotic fluid embolism, some OBs will be like, you don't have to worry about it. It's so rare. It's never going to happen. It does have to happen to 100 people a year. Yeah. So while I agree with you, that's another example of dismissiveness that doesn't reassure. What would reassure is for you to say, hey, let me take you through what our protocols are. We run drills. And if we had someone who had a cardiac arrest on our unit, if they had a suspected AFE, we have an MTP protocol. Here's what we would do. Here's how that would look. And so I encourage patients, if they do get dismissed at first, just by a well-meaning OB who's like a little superstitious and is like, we don't talk about that. Yeah. I get it. Yeah. I would have them push and be like, hey, I know you're trying to reassure me. What would reassure me is for you to tell me what you would do if that happened.
Yeah.
And I think every patient deserves that. It's not going to scare a patient more to know how you would take care of an emergency situation.
Yeah. Yeah. No, I think that's a great call out, right? We said this before, but so much of why I created this podcast was for my patients, right? Thinking about the thousands of people I've had the honor of caring for and their support persons, and understanding that there's so much more we can do to support them. And so each episode to me is creating space for these conversations that I think can be so informative as they are empowering and healing. But it's also very selfishly for my learning, right? My favorite episodes are the ones that I come out and I'm like, yes, I can do better. I can think about it this way. I can phrase it this way, right? Because I am a mere human, which means it's so humbling to care for other humans. But I think that there are those of us in the medical space that unfortunately do have the versions of God complexes. But I think there's a lot of us who are doing this with humility and recognize that we are lifelong learners, and we can always approach every situation with an opportunity to do better. So Kayleigh, thank you. Thank you for taking the time to, and I know that part of your space as an educator is to tell your story. And so I appreciate you yet again being honest and telling your story. I appreciate that you've, in this time, have paid homage to a lot of those unsung heroes, and yet you've still figured out a way to help me leave this conversation feeling that I will be able to care for my patients in a better way, and that anyone who's heard this will hopefully have the courage to talk to their OBs about trauma that they've already experienced or fears of things that maybe haven't happened yet, and have the language around that, and feel like they can have a space to advocate for themselves. I'm just so grateful for you. I know I'm not the only one, but I want to take the time to say I'm so grateful for you. I'm so grateful for this time.
Thank you. Oh my gosh. Thank you so much for having me. It has been an honor to be here. And OBs like you are honestly like what makes this work for me so fulfilling. Because it allows the bridging of the gap, right? Because you believe in trauma-informed care, you believe in this work that I feel so passionately about, and without that, we don't get anywhere. And so thank you for taking the time to have me on here and speak to you. And I always say, like, thank you for so much for allowing like my story and the work that our community does to impact you as a provider, because that changes outcomes. And that gives me, like, that's healing for me to be able to change future outcomes. And I'm just so grateful for you kind of lifting me up and giving me the space to do that.
Yeah. Well, the feeling is mutual, girl.
Thank
it really
you.
truly is. And you've shared so much sage words of advice, but any last words of advice that you'd want to give to any either moms to be or moms that are listening right now?
If you've experienced birth trauma or perinatal trauma, this will likely be one of the hardest things that you've ever had to go through, and you will do it. You will do it. And there are lots of supports and resources there for you. But I always know, and I experienced how hard it is. And I get a little choked up talking about this, but I've gotten choked up the whole time. But when I think about other people and how I experienced, I remember feeling like there was just no light at the end of the tunnel, that this was just going to be my life now. And I've had so many clients and so many community members feel that same way. And my feeling about that is always like, we will hold the hope for you until you can get there. Because we know that it will not always be this awful for you. And we know that there is hope to be had, but we also know that you can't see it yet, and that's okay.
Well, that's just a perfect place for us to end. Just leaving that light of hope and hopefully being the guide to get someone through that tunnel. So again, Kayleigh, so grateful for you, grateful that we can partner in this way, and that there's so many people like you and I who are here trying to lift up our birthers and moms and women and families that love them.
Yes, thank you so much. Your show is incredible. I can't wait for it.
Thank you very much for listening to The Golden Hour, the podcast community where moms and moms-to-be can hear stories from other mothers and learn from top experts in pregnancy and postpartum care. If you enjoyed this episode, please take a moment to like, subscribe, and share with your friends so we can reach more people like you. You can visit goldenhour.fm for more information, resources, and all other episodes. If you have any requests, questions, or suggestions for future episodes, please email me at hello@goldenhour.fm or leave us a comment at goldenhour.fm on Instagram. Looking forward to seeing you in the next episode. Until then, stay golden.